Hi, good evening. It's Mr. Krishnan again, and today we're going to discuss about an important topic that is the intermittent catheterization, that which is offered to certain conditions and urology patients. When we mention the word, when we mention this to the patients, that you have to catheterize yourself, that really puts a lot of stress, duress, and in certain patients, in some of them, panic as well. I totally understand why intermittent self catheterization, that which you have to do yourself, is so frightening. And I'll go through with you about what is intermittent self catheterization. This is a procedure where a tiny, thin, flexible tube is inserted into the bladder to drain the urine and then removed several times a day. It is usually advised and recommended by health professionals in those individuals who are unable to empty the bladder naturally due to various causes, medical conditions, or neurological issues. Very often, what we see in our common urology practice is the bladder becomes atonic, that is, the ability of the bladder to contract and empty the urine is being impaired, thereby leaving a pond of dirty urine, that which can propagate and promulgate more infection in the future, such as severe urosepsis. The intermittent catheterization is being advised in patients who is in urinary retention, those who are retaining urine, neurological conditions such as multiple sclerosis, spina bifida, when the bladder muscles are unable to contract, which we call it as atonic bladder, who cannot expel urine, blockage in the urethra, preventing the urine flow. How is it done? It's been done hygienically, and it has been taught by well trained professionals like outreach nurses, um, nurse specialists. Hygiene is the most important aspect. Catheter insertion is gently introduced into the urethra until the urine drains out. Once the bladder is empty, the catheter is removed, and the intermittent catheters are single use catheters and they should be discarded after use. The types of catheter, as such, we know is we've been discussing mainly about intermittent self catheter. There are types of indwelling long term urethral catheter as well. The benefit of intermittent catheter is to reduce the infections, reduce the future infections, reduce urosepsis, improved bladder function, most importantly, the increased independence and the less societal dependence. And the potential risk with self catheter is some patients have told me that after they started the self catheter, they've had multiple infections. Yes, UTIs are something which we have to contend with, urethral trauma, bleeding, irritation, catching of the catheter. Very rarely, urethritis and stricture, narrowing of the water pipes can happen. The most important consideration here is the proper training, regular monitoring, fluid intake, understanding the technique of self catheter. I hope this is helpful, and there are leaflets available for you. When you come to see me next time, I will provide you with leaflets of how to perform intermittent self catheterization in females and males. And that's about it. Thank you.